Good morning. Today we have a patient. This is a known case of bilateral complete cleft lip, cleft palate, and cleft alveolus. We have done her multiple surgery to correct her deformity. We have lastly done her Leafort 1 advancement surgery and followed by anterior palatal fistula closure using a tongue flap. So today we are planning to depediculaze the tongue flap. Along with that, we are planning her upper lip augmentation surgery and lower lip reduction surgery. So usually in a case of bilateral cleft, upper lip, even after proper repair, upper lip is slightly hypoplastic. There is a volume deficiency in the upper lip, and because the muscles are tightly approximated together, the upper lip remains on the back side and the lower lip is slightly relaxed and it looks little bulky. So there are certain ways to correct this deformity. Most commonly used is the Abbey flap. So we can transfer some tissue from the lower lip to upper lip, but many times that doesn't work well. So today we are basically planning to do some fat injection in her upper lip. Along with, we will do lower lip reduction surgery. So lip reduction surgery is like very commonly used even in a normal patient where the lips are looking bulkier. Those cases we do lip reduction surgery. It's a very simple surgery. It can be done under local anesthesia. It's a office-based procedure, and the surgery can be done under local anesthesia. In surgery, we usually do the marking how much lip we need to reduce, and after the marking, after injecting local anesthesia, we do full thickness bulk reduction like the mucosa as well as the muscle, and then after checking that the volume reduction is proper, then we do the closure with a dissolvable suture. So patient do not need to come back for the suture removal. Downtime is 1 or 2 days. Like patient is usually advised soft diet. The patient has to apply some lubricating gel over the lip and little bit swelling for a couple of days, and then usually swelling settles down, and patient can resume office maybe after 2 days. There is not much of a restriction in this surgery. We usually advise antibiotics for a few days along with painkiller. So lower lip reduction is a very simple surgery, and it is highly used for in a aesthetic surgery, mainly for the bulky lip or which lips looking more thicker to reduce those kind of a lip. Thank you.